All right, my clock says 11 o'clock, so let's get started. Before we get started, I'd like to do a quick audio check, make sure you're aware of some of the accessibility and translation features that are available to you. If you hover over the presentation screen with your mouse or tap with your mobile device, you will have the option to select the settings gear to activate closed captioning subtitles. Also, but still a bit experimental, this webcast will be translated live into 6 of the most spoken languages aside from English available with this technology in British Columbia. You can access this feature from the same gear menu. Okay, so my name is Dale Johnson. I'm the Information Systems Manager at the Manufacturing Safety Alliance of BC, and I will be your moderator for today's webinar on exposure control plans. In a few moments, I will be introducing you to Manufacturing Safety Alliance of British Columbia Chief Operating Officer Wayne Arandas, who will be providing some opening remarks. But first, I'd like to take care of some housekeeping. In the top right corner of your screen is a comment icon. This webinar features a question and answer period. We aim to provide as much information as possible to the broadcast audience, but we are happy to field your more unique scenarios and questions and circumstances through our QA process. In the top right corner of your screen is a comment icon with a question mark in it. Click that to activate the question and answer side menu. If you don't mind, please include your name along with your question. Our goal is to answer every question submitted, but we may group similar themes into one to cover as much ground as possible. Over the last week, our team has compiled a library of news stories, resources, important upcoming events that affect not only our members, but the manufacturing industry as a whole. And these are all available at our website, safetyalliancebc.ca/COVID-19. Before our webcast began, you may have noticed a slideshow of tips for coping with COVID-19 in your workplace that may help you in the present and beyond. These suggestions all came from member companies and were shared with the hope that we can learn from each other. If you feel that you have an innovative idea to work around the challenges presented by COVID-19 that would benefit another manufacturer, feel free to submit them to us, and we'd like to share them with a larger audience. While the suggestions can range from common sense to outside the box thinking, it's important to be reminded, even at the best of times, we don't always have all the answers, but sharing our wisdom with each other can and will get us through this. On a lighter note, we have included all the good news stories we have found about manufacturers in British Columbia who are demonstrating tremendous leadership, ingenuity, and goodwill during these challenging times. I speak on behalf of my colleagues when I say we are incredibly proud to be associated with you and your teams, the frontline workers, the individuals who are charged with keeping them safe through your roles in occupational health and safety, and the leadership who is guiding each of you through uncertain times. We will take every chance we can to recognize your incredible contributions. Last, and just added to our COVID-19 resources, is a page dedicated to help guide you through the challenges we know many of you are facing in securing a reliable source of PPE. Working along with our partner organizations, we will be sharing any sources or suppliers we are aware of that will help equip your crew to work safely. And if you're still listening, I personally want to thank everyone who took the time out of their day to participate in this webinar and came to listen to Lauren and Jasmine present on exposure control plans. While healthcare workers and frontline service workers are receiving a lot of public recognition, and don't get me wrong, all of it is completely deserved, we want to shine a light on you. I don't think it can ever be overstated the importance of the role you are playing right now in manufacturing the products that keep our supply chains flowing, for processing the food that allows our supermarket shelves to be stocked, processing paper products, yes, paper products, including paper meant for toilets. And where would we be without our friends making beer, wine, and spirits for the liquor store? Seriously, COVID, stay away from the wineries. Bottom line, we are rooting for you guys as much as we are counting on you. We want to be able to, and we want you to be able to count on our team to get you the help that you need to get through this safely. Just a quick little bit of background. Manufacturing Safety Alliance of BC is an industry-driven, not-for-profit health and safety association for manufacturers and food processors. We provide on-site classroom and online training on workplace health and safety. Our team of safety advisors give employers confidential help to build and improve their health and safety programs and achieve the Occupational Health and Safety Standard of Excellence certification. To give more information about our response to COVID-19 and the ways we are here to support manufacturers, please let me introduce to you our Chief Operating Officer, Wayne Arondis.
Good morning, everyone. Thank you very much for joining. Thank you, Dale, for the introductions and the explanation of what it is that we're here for, and that is to help all of you and provide you with timely, accurate, up-to-date information on how we can all better work through the current situation with COVID-19. As you know, the Alliance works tirelessly to try and scour the news, the different organizations with the Center of Disease Control, the public health authorities, and every other government agency to try and find out the latest information in order to better equip you with timely solutions to what it is that you need. So this webinar is really about, after COVID, during COVID, what do we do? And so I'm really excited to have Lauren and Jasmine share with you this morning their insight and their webinar today. A couple of things I wanted to make mention that the Alliance is working on over the next few months as we continue to support the industry. We want to include access for all manufacturing companies, regardless of membership, to support the humanitarian effort to contain the spread of the virus. So through our educational resources, webinars like today, these resources and related information will help hopefully show and how to develop exposure control plans. We are looking at weekly webinars, and certainly at the end of this webinar today, looking for some feedback on future information requirements, perhaps from industry, the government, the WorkSafe. Again, focusing on key information that will help you all in your decisions to safeguard your businesses and ultimately your employees. Additionally, we want to provide online and telephone support for all manufacturers, preparing plans based on guidelines and leading health expert recommendations for integrating within your OHS programs. So again, our advisors are available to you, and we'll continue to provide that support that you need. Please feel free to reach out to us so that we can provide any information you might need. And lastly, we want to be looking at research, learning where the current use of N95 masks exists and where substitutions of other PPE that is equal or greater protection to is possible where the N95 masks are falling short in supply. So this is a specific task that the government has reached out for us to provide assistance, and we'll continue to work with the government agencies in order to provide you with the latest and greatest information. So with that, I want to move on to the most important part, which is our webinar. I want to thank you all for participating today, and we look forward to serving you in whatever way we can as your health and safety organization. So thank you, and I'll pass that on to Dale.
All right, thank you, Wayne. So let's get on to our presentation today, exposure control plans. So we have two presenters covering this topic today. First is Jasmine Kelsey, our occupational hygiene specialist at the Alliance. Jasmine has been with the Alliance for 3 years, assisting clients with concerns relating to air quality, noise exposures, and exposure control plans. Her experiences include assessing risks and exposures to crystalline silica, welding fumes, volatile organic compounds, as well as working with clients on toxic process gases, such as ammonia. Jasmine holds a Master of Science in Occupational and Environmental Hygiene from the University of British Columbia and a Bachelor of Science in Chemistry from Simon Fraser University. Joining Jasmine today is Lauren Davies, a safety advisor and combustible dust specialist at the Alliance. Lauren has a diploma in civil engineering technology and has worked all over British Columbia in the mining, sawmill, and biofuel industries in roles ranging from mine rescue team member to volunteer firefighting roles to director of safety and environment. He has in-depth process experience and training in fire protection systems, spark detection systems, and explosion protection. Lauren has been supporting Alliance member companies since 2016. Lauren, would you like to get us started?
Thank you, Dale. Everyone hear me okay? Great. I'd like to thank everyone for taking the time to attend this webinar. Jasmine and I have put this presentation together to assist our clients in moving through this crisis and to be better prepared for the next viral threat. In the past, we have hoped for a good flu season. We'd like to take you to the future where biological threats are managed like any other safety hazard instead of depending on luck to protect your employees. The COVID-19 pandemic has opened our eyes to the consequences of uncontrolled virus spread. As employers who have workers in essential services, it is our responsibility to protect workers under our supervision. To protect our employees, we have to follow a systematic approach to identify the hazards, quantify the risks, and develop the controls to mitigate the hazards. Using this same process for respiratory infection threats such as COVID-19, influenza, pneumonia, tuberculosis, measles, mumps, and chickenpox will all be effective. Following this strategy will build biological controls into your work processes. As a result, employee sickness, the number of sick days logged, work interruptions, and downtime will decrease. To give you an idea of the possibilities, if we reduce the average number of sick days by 10%, it could add 4 million workdays to the Canadian economy. Failure to respond to threats will leave us with COVID-19 type responses that have enormous impacts to people and the economy. When you stop a virus from spreading in your facility, worker health, engagement, and productivity will increase. The tool we use to protect employees is called an exposure control plan. It is your roadmap to identifying biological hazards in your process, determining who is at the highest risk of infection, and establishing the practical controls and training to protect them. Let's get started. I'd like to pass this over to Jasmine Calcy, our company hygienist, to continue.
Thanks, Lauren. So as Lauren has mentioned, the tool that we should be using is an exposure control plan. You may have heard of this or may even have this sort of plan already existing in your workplace. And if that's the case, the format itself is not too different. For example, this type of plan you generally see for welding fumes or for protection against any known carcinogens at your workplace. It's pretty much the same concept, except now we're looking at biological contaminants. For those of you who don't know what an exposure control plan is, it's a written, formal document that specifies how you, as an employer, are protecting your workers from a specific contaminant. In this case, our focus in this webinar are biological contaminants. Biological contaminants are agents such as viruses, bacteria, fungi. This also includes yeasts and molds, and other microorganisms and their associated toxins. When we look into the occupational health and safety regulations, a requirement of having an exposure control plan is specified under Part 6, Section 6.34. I should add, as a caution and a disclaimer, this requirement is more directly related to persons that have an occupational exposure to biological agents. It wouldn't apply to general industry on a normal day, but more so towards healthcare professionals, including doctors, nurses, occupational first aid attendants, whoever it may be. However, given the situation we're in now and what we may be facing again in a couple of years, having a plan where we as the employer know what to do to protect our workers who are essential is certainly helpful. Under the Occupational Health and Safety Regulations, Part 5, Section 5.54, it specifies what should an exposure control plan include. It normally consists of, at a minimum, of 8 topics. These are a statement of purpose and responsibilities, risk identification, assessment controls, education and training, written work procedures, hygiene facilities and decontamination procedures, health monitoring, documentation, and review. I should add, those who are listening in and attending this webinar, there certainly can be additional sections which may apply to your organization. For example, those in food manufacturing may need to align with additional specifications listed by the Canadian Food Inspection Agency. A doc will be referred to at the end of this webinar. For the remaining portion of this webinar, what we're going to do is go through each of these sections listed in the slide. Some sections will focus on a bit more in detail. We'll factor in scenarios which we feel are important to highlight, and from there you can see what you can include in your plans. Starting off, we'll look into the statement of purpose and responsibilities. Within this section, a statement specifying the company's commitment to prevent exposure to biological contaminants is mentioned. Also included is a list of responsibilities of all related persons. This can be the employer, the supervisor, the workers, the first aid attendants, whoever is important for the success of this plan. I'll give you some examples. For the employer, responsibilities can include selecting, implementing, and documenting appropriate site-specific control measures. Another responsibility can be ensuring that the materials, for example, gloves, alcohol-based hand rubs, and washing facilities, and any other resources are readily available where and when they're required. For supervisors, an example of a responsibility can be ensuring workers are adequately instructed on the controls for the hazards at the location. And for workers, an example of a responsibility can be following established work procedures as directed by the employer or supervisor. Again, include only those parties which are relevant in the successful completion of your plan. The next section is risk identification, assessment, and controls. We'll start off with risk identification. For biological agents such as viruses, it's important to first realize, understand, and acknowledge the possible routes of transmission. Transmission routes include direct contact. This can be skin to skin. This includes handshakes, performing first aid, or any other scenario where direct contact can occur. This is something that we do on a common basis, as well as something that we do intuitively. The next one is indirect contact. This includes touching door handles, which were previously touched by an infected person, for example. Other examples include common workplaces within the office or within the production floor. So some questions to consider are, do any of your workers share tools? Do they share personal protective equipment, PPE? Is there sharing of kitchen utensils, bowls, Tupperware? Is there a common fridge, microwave, stove, whatever it may be? Is there sharing of spaces such as workstations or meeting rooms? Do you frequently get packages delivered from people that don't work at your organization? All of these can be a potential indirect contact source. And the next one is pretty self-explanatory, this one being droplet transmission. This includes coughing and sneezing. The potential for exposure will vary from workplace to workplace and will also vary from task to task. And it's important to assess the risk of exposure, factoring in all these scenarios, so appropriate controls can be implemented. Within your risk assessment, as a suggestion, it's a good idea to start off with a job title inventory and maybe take it even further, looking into an inventory of all tasks within those jobs. Starting here will give you the bird's eye view of what jobs or tasks need a particular focus. When evaluating these tasks, we need to determine what the risk level of exposure are. Risks, for example, can be classified as low, moderate, or high risk. Low risk can be defined as workers who rarely come in contact with potentially infected people or materials. Moderate risk can be workers who indirectly come in contact with infected people or materials. And then high risk are those workers who work directly with people who may be infected. This systematic approach will keep you organized and guide you in ensuring that everything is covered. Ultimately, it's your own risk assessment which will justify what controls should and should not be implemented, and the document should be referred to when making decisions. on protecting your workers. Once you've determined the risk levels, the next step would be controls. And for controls, I'll be passing it back to Lauren to cover this topic.
Thanks, Jasmine. I'd like to take a few moments to explain this graphic. For those that are familiar, please bear with me. Selecting the best controls for your situation is the most important decision of this process, regardless of the hazard you're trying to address. Selecting the proper controls will provide lasting value and risk reduction, so spend some time here to discuss and debate before jumping to the quickest solution, which is usually the least effective. The graphic illustrates that as you move down the triangle, control effectiveness decreases and supervisory effort to maintain the controls increases. Personal protective equipment is the least effective control because it does not address the hazard. It merely is a barrier to the harm addressing the employee. Failure to wear, maintain, or supply properly will result in the employee being exposed to the hazard. The first question should always be, can we eliminate this hazard by changing our process or procedure? For example, having a viewing room eliminates the need for visitors to be on the production floor to view the process. The next question, is there a less hazardous option available? For example, a designated walkway that keeps visitors a safe distance from employees but still allows them to see the process and the product. The next question, is there an engineering solution to prevent this contact? For example, using a virtual tour by computer that would provide the information required in real time. In support of the above controls, plan on having administrative policies, procedures, and training to keep everyone on the same page. Lastly, you need to evaluate the PPE required as the final defense if there is a lapse in controls. The next slide here is on engineering controls. There are a few examples of familiar engineering controls available to assist with reduction in exposures to biological hazards. These are touchless hand dryer. For instance, here's some pictures. Motion sensor paper towels, foot controlled sink, robots for sanitization, physical barriers, isolated rooms, ventilation, computers, voice activation. Next slide, Dale. Here's some pictures of these, just so you have an idea of what we're referring to. There's a bank that has a barrier here that shows the physical barrier. We also have a hand dryer that operates without contact. This next one is a hand washing station that is set up for no contact hand washing. It includes motion activated taps, soap dispenser, paper towel dispenser. You'll also notice the garbage can is foot operated. I'm sure you're all familiar with the airport style washroom. It has no entrance doors to open, to access the facilities, or to leave. Here are a few more examples of how technology can help limit exposure. Through online conferences, robotic sanitization, or voice-activated computer software, there are more of these being developed every day. Back to Jasmine.
Thanks, Lauren. Next up, we have administrative controls. At a time like this, administrative controls may be our quickest control routes, and it's one of the most common types of controls we come across in our daily lives. Example of administrative controls, which you can consider for your workplace, include hand washing protocols, where you would ensure to wash your hands for at least 20 seconds, to coughing and sneezing etiquette, where we encourage to cough into our elbows rather than into our hands. Other administrative controls include having safe work procedures for donning and doffing PPE. If this is something you don't have in your workplace, maybe it's something to consider during a time like this. For example, if gloves are used in the workplace, are there procedures for how to properly remove gloves to avoid clean hands from contamination? For any such procedures developed, training and education to your workforce is vital for the successful completion of these controls. Employers must ensure that workers are informed and are aware of what the procedures are in place, and also give a platform to workers to clear any doubts or ask any questions. In the case of visitors and employees and even contractors, having a set policy in place and procedures in place in dealing with persons who are external to the organization, allows you as the employer to reduce the risk, and protect your workforce as appropriate. Procedures can possibly include having visitors wash their hands before entry onto the production floor, for example. This is a common practice in the food industry, along with donning appropriate PPE. Other practices which can be considered include not allowing any visitors on the floor, or ensuring safe distances are kept on the floor. I'll show you an example on the next slide when we get to that. Another way is asking your visitors and contractors to pre-fill a short survey, asking if they are feeling unwell or sick. What stance would you take if some contractor shows up to your site and they say they feel unwell? For internal workers, to minimize the amount of direct contact, can you stagger the breaks where only an X number of workers are in the lunchroom? Can you stagger your shifts where X number of workers are on the production floor? In regards to reporting procedures, having a policy in place where workers are required to report to the first aid attendant and supervisor if they're feeling unwell is a good control to avoid spreading of viral biological hazards. Consider your own current procedures and see what they are. Do you require your workers to report from home before 9 a.m., for example? Do they even know that they have this option? In terms of PPE, it's a good idea to have a program in keeping and maintaining an emergency PPE inventory. This can be justified for the continuation on critical tasks, so businesses can continuously run. For example, having a 3-month or more supply in appropriate PPE may be a good practice to have for the future, for the next big thing. This will allow your workplace to be protected. As I mentioned in the last slide, an example for visitor management, where visitors adhere to painted walkways, saying no one is allowed past this point if you are a visitor to the organization can be a type of control. You can also tape off areas which are only employee only, for example. For the case of seasonal flu, we lose a lot of workers to time off because of this. Having an optional opt-in program, giving the choice, having someone come on site before the flu season starts to give flu shots can be an effective control. This can be an option to consider in your workplace. It could potentially contribute to a healthier workforce during the flu season. These are some things to consider. Next, we need to consider protocols for workers and people who are not working here locally. For example, what type of protocols should be implemented where you may send your workers out internationally or out of province? Or if you're bringing in contractors who are out of province or country. Some things to consider. How would you deal with workers who are required to travel for work? And what would you do when they return? Some examples of protocols can be having no meetings with your workers who have returned from overseas or out of province for at least a few days or a week. You'd monitor for symptoms first. Can they work from home doing tasks such as training courses or other paperwork? The thing to consider right now is, how are you going to deal with these scenarios in 2 months' time or 6 months from now? It's better to have a procedure in place so everyone is not scrambling in the last minute. For this, we would also just suggest consulting with human resources when setting up these protocols. And lastly, for administrative controls, we have the sanitation program. As we mentioned before, routes of transmission can be from indirect contact. So the question becomes, in the event of a pandemic or even during the flu season, how does your sanitation program compete? The questions to ask are, when should sanitation take place? How regularly should it be done? For example, should sanitation of the lunchrooms be done right before lunch or after lunch or both? How about the meeting spaces? Do you disinfect before or after meeting, or do you do both? What grade of chemical are you using to sanitize? Does your program allow you to have enough in stock for an event like we're going through right now? These questions that I posed to you in the administrative side of controls can be answered through your risk assessment. And I'll pass it to Lauren to cover our personal protective equipment.
Thanks, Jasmine. PPE is the last line of defense. Face shields, respirators, safety glasses, smocks, boots, gloves all fit in this category. It is very important to select the proper equipment based on the hazard and risk present. For example, if you have to protect a flight attendant on an 8-hour rescue flight carrying potentially infected passengers, this is a high hazard, high risk, long duration task. The best solution might be to provide a powered air purifying respirator, or a PAPR. The flight attendant face is protected by the face shield from the exposure. The flight attendant cannot touch their face without removing the face shield. No particles can enter the breathing zone because the positive pressure filtered airflow is delivered to the face shield from the PAPR. This unit is comfortable enough to wear for an 8-hour shift without undue frustration that would cause it to be removed. No fit test is required because of the positive pressure air delivery method. Again, choose the right equipment for the right task.
We have put a considerable amount of focus on the controls aspect of this webinar, and that's within reason. With controls and as a requirement as one of the components of your exposure control plan, the employer must ensure that there is proper training and education provided on the content of this plan. We divided the education and training aspect in 2 sections. One's a bit more general on what you'd want to be trained on. For example, what are the risks, signs, of symptoms of being exposed to a certain biological hazard? What are the safe work procedures? How to seek first aid? How to report symptoms of a respiratory infection? These will be covered here. The other section for education and training involves a little bit more specific detail. Notable attention would be to your higher risk groups. The first group can be considered here would be your cleaning and sanitation workers. Some questions to consider. Are they wearing the right personal protective equipment to clean? Are they trained on their personal protective equipment? Are they trained on chemical safety? Do they have their WMIS 2015? Do they know the proper cleanup or disinfection protocols in place? Which areas require regular disinfection? And anything else along the lines of that. Your next group would be your public point of contact employees. These workers include your reception, the shippers, the receivers, the workers in the warehouse. This even includes your company tour guide who would deal with visitors, for example. Some things to consider. Is training and education provided on the visitor policy? Do workers know what procedures they can follow to limit their contact with the public when on the job? And the last high-risk group can be your sales and installation teams. The question to consider is, if you were to send out your team locally or internationally in the near future, how would you protect them? What would you train and educate them on? What sections of this ECP are more relevant to them than others? Protocols can be set, and you can ask them to stay away from open markets, eat at reputable locations, stay at reputable hotels, minimize interactions with non-business contacts, having proper travel insurance, so access to medical services is easy if they need it. These procedures work into the next section of your exposure control plan, and I'll hand it back to Lauren.
Thanks, Jasmine. In order to communicate safe work procedures effectively, we need to keep them simple and to the point. Use pictures whenever possible to reduce the dependence on reading and language difficulties. Use signage, like the one in the example here, to designate at designated locations to trigger proper behavior. Communicate the importance of procedures to supervisors so they act on their responsibility to enforce them. Back to Jasmine.
For hygiene, facilities, and decontamination procedures, in this section, what you want to specify is in detail is on what ways you, as an employer, are providing hygiene facilities, as well as instructions to workers on how to decontaminate. For example, for hygiene facilities, you would specify where are the sanitation stations, where are the sinks with running waters, where are the showers on site. Whatever it may be, it should be written here. For the decontamination procedures, consider if PPE is reused between workers or reused for themselves. How are they decontaminated? What are the procedures? And how about common spaces? What are the procedures? What are the schedules for decontamination of common areas and equipment? The next section is for health monitoring. In this section, it's important to have a developed protocol for employees on reporting any symptoms to the first aid attendant. You may also want to specify within this plan what other steps you are taking to monitor the health of your workers, should you choose to do that. For example, you may track the number of cases within your organization, maybe segregate them per department or job title, and see if there are any hotspots that more attention should be put upon, or if further intervention is needed. Or if cases are on the rise in general, what does that mean for your company? How can you be proactive to stop this rise within your own organization? These would be some of the things you want to consider in this section of the plan. Lauren?
The fun one is documentation. Whenever you're doing training and instruction, there should be some kind of record. And whether this exposure reports or first aid records, or even investigations of exposure incidents, having the required documentation systems in place will prove your due diligence regardless of the particular threat. And as employers, I'd like you to remember that if there is no documentation, then it did not happen from the regulator's point of view. Back to Jasmine.
And the last section of your exposure control plan is the review. As with any other occupational health and safety program, it's good practice to have a regular review of your documentation, as information can change frequently. The exposure control plan should be reviewed at least on an annual basis at a minimum. Reviews should be done in consultation with the Joint Health and Safety Committee or your health and safety rep on site. Keeping the Joint Health and Safety Committee updated with any changes is a good idea, so they can assist in communicating those changes to the workforce. This concludes what should be considered in your exposure control plan for biological agents. But before we finish, I'd like to discuss briefly of how this plays into your emergency response plan. Every organization should have an emergency response plan, and events like what we're going through these days should be considered. Your exposure control plan, though it's a separate entity and document, should be referenced in your emergency response plan, because when you have events like an outbreak or a pandemic, you'll have a game plan. When we think of our exposure control plan for biological contaminants in general manufacturing, on a normal day, it may only apply to a certain group of workers, as I mentioned before, like your first aid attendants. But that said, in events like a pandemic, having the exposure control plan referenced in your emergency response plan, it gives you the ability to include a larger demographic of your workforce, where these controls and procedures might be more applicable and important than it was before. So it's something to consider when drafting or reviewing your current emergency response plan. Lauren?
In order to support you further in your ECP development, we'd like to provide you with the following resources. They can be downloaded from our website at MSABC or requested from your safety advisor. We have also prepared a biological ECP template for your use to save on your typing. This will be sent out to all participants in the days following the webinar. Again, if you need help, you can always feel free to give us a call at the Safety Alliance. And I hope that we have raised your awareness around biological hazards and have given you a new strategy to deal with existing and future biological hazards.
All right. Thank you very much, Lauren and Jasmine. Excellent information there. We're just going to jump straight into our question and answer. Jasmine, this one will go to you. Does this apply to all workers throughout the year or just during the pandemic?
As I said in this webinar, generally an exposure control plan would refer to those workers that has the potential to be exposed to a biological contaminant. So it would be more particularly focused to your first aid attendants. So throughout the year, not so, but given what we're in right now, it might be more applicable to those who are essential.
All right, thank you. Lauren, with social distancing in mind, what would you suggest we do regarding emergency evacuations? What does a procedure for this look like?
At this moment, I haven't a template for an evacuation in this environment, but basically we have to follow the transmission guidelines of social distancing and making sure that we keep our people safe by distance. So we'd have to have a slightly larger area, And again, keep your people passing through the person that's taking your roll call so that you could have a proper evacuation, ensure that everyone has evacuated properly. And it would just be tailored to your particular site.
Excellent. Jasmine, what chemicals do I need to disinfect?
Usually for disinfection, what you want to look out for on the label would be hospital grade disinfection chemicals. So I'm not too sure in terms of like alcohol content, but usually they are labeled as hospital disinfectant. So look out for that.
Okay. Lauren, are there any additional recommended controls for first aid attendants in the case of a first aid emergency?
My first response to that is that obviously in an emergency situation, you do the best you have with what you have. But my first choice would be to wear a face shield, again, to protect the worker from droplets coming from the injured person, and just to make sure that any contact situations, you wouldn't be tempted to put your hand up to your face.
Okay. Jasmine, if people say they feel sick or are sick and we send them home, should we request that they get tested?
We can definitely request for them to get tested, but ultimately it's the doctor's call, right? So it's kind of out of our scope. We could definitely put that request in, but it's ultimately on the doctor to give that referral, should they need a test or not. Otherwise, you would follow the guidelines that are given out by the province of British Columbia.
Okay. In the case someone suspect had symptoms and decided to stay at home, how should we clean the area where this person worked before? And can we assign someone to the same spot? Lauren?
Yes, you'd follow the hospital grade disinfection process of wiping the areas down, and the person that comes in, if you put them in the proper protective equipment, there should not be any issue. You should be able to clean the surfaces properly before that person attends that spot.
Okay. Lots of questions coming in quickly here. Thank you to everybody who's submitting them. Due to social distancing, this one will go again to Lauren. What do we do when we have two employees attending a job site in the same truck?
This is a tricky one because obviously this is something that we do every day. And how do we separate those people? The best thing we could do is to actually put them both in a mask so that we could reduce the area of contamination to a smaller area than the 6 feet. And again, if we put them in a face shield, that would be beneficial as well, because then they wouldn't be tempted to touch their face during this operation until they could get to where they're working and wash and start their process.
Good. Jasmine, how would you handle a refusal of unsafe work if the only control is physical distancing and hand washing due to a lack of disinfectant to spray down because of short supply?
Right. So given the situation we're in now, you have to attend to the right to refuse, right? If a worker comes out and says they refuse to work, then it should be addressed. In terms of responding to it, again, given that there are a lack of resources available to clean and disinfect, you have to do your risk assessment and see if their concern is still valid or not, right? In the end, your risk assessment will justify whatever is in place if it allows a worker to have a safe working environment. So I'd refer back to your risk assessment for that, but I'm not asking Lauren if he has anything else to add to that answer.
Yes, the big key is the assessment portion, saying what is the actual hazard present?
Yeah.
And is there actually someone that's been sick in this area that's caused a problem that people are concerned about, or is it just a media concern where people are unsettled? So the key part is your assessment, as Jasmine said, and identifying any hazard that is actually present. From that point, then you can look at reviewing the controls to see if you can protect that person further to allay their concerns. That could be with a plastic shield or some protective equipment. The key part is addressing the hazard, as Jasmine said.
Okay, back to Jasmine again. Is it still okay to mix 30% water on top of 70% concentration alcohol, thus resulting to 50% alcohol for sanitizing high-touch surfaces?
That's, I don't know. That's good. I would have to look into that a bit more. I wouldn't be able to give you a good answer.
This is an excellent opportunity to point out that there are a number of questions that I have witnessed so far that I know that we won't be answering on the spot, but our FAQ section on our COVID page, once we have a little bit more time to put some thought and debate into thoughtful answers here, we'll post them there. And that may be one of the questions that gets put up there.
Yes.
Lauren, with regards to the recent health authority recommendation about wearing non-medical cloth masks when social distancing can't always be maintained in public, can you comment on this as it relates to the manufacturing workplace?
Well, when the mask thing is very confusing. What we have to understand is that because of COVID-19 particularly, it's very difficult to assess who has it and who doesn't. So if you've been in groups and you're not sure if you have it, even wearing a surgical mask or a cloth mask will really reduce the amount of droplets that you spray out of your mouth if you sneeze or cough in relation to people around you. So wearing that will protect other people from you. Now, having it the opposite way, those masks are not quite as effective as an N95 for screening out droplets. So they will reduce your risk, but will not eliminate it. Now, I'd just like to point out a little caution that even with an N95, it is not 100% perfect, and it's still based a lot on the seals that are generated with your face. So again, a lot of these procedures are helpful, but they're not perfect. So just keep that in mind.
We have a follow-up question related to N95 masks, and it's related to dust. So Lauren, this one for you. Can we replace N95 masks that we're using for dust for something else? We would like to send what we have to a hospital.
Yes, actually, if you have reusable half mask respirators, for instance, you can use the cartridge type that are either N95s or, for instance, P100s for your workplace. If you have additional masks that you could get rid of, as long as you can still protect your workers with a half face or a full face type respirator that is a reusable style versus a disposable one.
Okay. Thank you, Lauren. Jasmine, and this is a follow-up question on travel. What if more than one employee is driving to a work site and the drive is more than 4 hours? It may not be possible to put face shield or masks for the duration of that drive. Suggestions?
Again, we have to factor in the physical distancing requirements, right? If a distance of 2 meters can be kept, again, I'm always going to default back to your workplace, your risk assessment, because again, in certain tasks, we can't have the 2 meter physical distance. It's not practical or it's not possible, right? I would first suggest, if it's possible, to maybe go up in 2 cars or take some other type of route of transportation up there when you guys could separate. But if that's not the case, maybe just doing your pre-checks, right? Do symptom checks. Are they in contact with anybody who has been sick in the last week or 2 weeks? Do they feel okay? And then just do your risk assessment, see the likelihood and see how they're feeling, and then take it from there.
I have one thing to add for that.
Yeah.
If you were in a sedan type car, it would be quite reasonable for you to take a sheet of plastic and just tape it to the roof between the seats, and the person could be in the back seat and the driver could be in the front seat, and you'd have separation.
Yeah, that's a good control.
Okay. Lauren, you may or may not know this, but I'll ask anyways. How safe is it to work in a place with central air conditioning and no access to window or fresh air? So it's really an air circulation question.
It's very difficult just to pull that out of the out of the air, because obviously every situation is different. A lot of factories that don't have good windows or opening that way have very sophisticated air vac systems with HEPA filters for filtration of the air. And in those situations, I think you would be very good. Other situations, maybe not so much. So again, you'd have to look at your particular company's situation to determine how effective it actually is and how much you're actually circulating.
Excellent. Kind of last call for questions, everybody. We do have a number that have not been answered yet, but as to my earlier point, I think that some of these questions will need a little more deliberation. You know, it's important that we're accurate, as it is timely. So we will get those up onto our FAQ section on our COVID page as soon as we can. But if there are any other questions, now would be the time. Otherwise, we'll wrap this up. Okay. Here they come again. Is it okay? This looks like a PPE question. Is it okay to reuse clean room coverall the next day or more? We are making medical products inside the clean room and not dealing with patients. My operator concern is that the gown, the internal side, had already come into contact with outside clothes.
The easy answer would be no. In this case here, I would think that you'd err on the side of caution, and if it's been in contact with outside the room, I would not be using it again. If it had not had contact, then it could be considered.
Yeah, I would probably refer everyone to the BC CDC website for more tips on how that works as well. What we do know is that, you know, contact certainly is a way to spread this virus. It can stay alive on surfaces. So I suppose anything that could be contaminated at any time is a potential to spread as well. So, okay, so a number of questions coming in related to whether or not this webinar will be made available for download, whether the PowerPoint will be available. The answer to all of those is yes. We will be emailing out a link to all participants with a recap. But for anyone who wasn't able to attend today, the content will be made available on our website for sharing at a later date. So expect to see that sometime today, maybe tomorrow, and we'll get that out there to you as quick as we possibly can. I'd like to thank our Chief Operating Officer, Wayne Arondas, again for his opening remarks. Jasmine and Lauren for doing an excellent job on exposure plans. And as always, please visit our website, phone us, use our email. We're here to help. We want to be a source of information and a conduit to safe work for all of you. So once again, thank you very much for attending this webinar, and stay safe out there. Thank you.